Today we're going to discuss two different types of insurance plans, the HMO and the PPO. While there are a variety of other types of plans, these are two of the most popular. Before we get into the discussion about the benefits and drawbacks of each plan, I'd like to go over some insurance terminology that is often used, but that you might not be completely familiar with. One of the most important things to be aware of when choosing an insurance plan is the network. The network is the providers that have an agreement with the insurance company. At its most basic, the doctor says, we charge this for a service, and then the insurance company says, well, we'll pay this much for the service. And if they can come to an agreement, they sign a contract, and they are now in network. Some plans have limited networks, some have open networks, some have tiered networks, but we'll discuss that a little bit more later. Cost is always a big factor when considering insurance plans, and there are a lot of different costs associated with them. First is your premium. This is the amount you'll pay for coverage on a monthly basis. Your deductible is the amount you pay in addition to your premium before your insurance will cover anything. Some plans have copayments, which is a fee you pay per service. Like if you go to your family doctor, you might pay $20. If you see a specialist, it might be $50 a visit. Some plans have coinsurance, which is kind of like a copay, but instead of a set dollar amount, it's a percentage of the whole cost. So if you go to the doctor and the total cost of the visit is $200 and you have 20% coinsurance, you pay 20% of $200. Now that doesn't seem bad if you're just having that $200 office visit, but if you need an $80,000 surgery, it will add up. That brings us to the last very important discussion about cost, which is your maximum out-of-pocket. This is the total amount you will have to pay for covered medical services per year. So if you have 20% coinsurance with a $10,000 out-of-pocket maximum and you need that $80,000 surgery, you'd be responsible for $10,000 and your insurance would pick up the rest. When dealing with doctors, there are a couple of different types of referrals. If you go to your PCP and you're discussing an issue and your doctor says, I'd like you to see a specialist, I'm going to send you to a neurologist. You are being referred to a neurologist. This is not enough for some type of insurance plans. Some types of insurance plans, mainly the HMOs, need a referral documented with them as proof that you didn't just wake up one day and decide, hey, I'm going to go see a neurologist, just for the heck of it. There are a limited number of benefits called direct access benefits, where it doesn't matter if you have an HMO or a PPO, you can get these benefits without a referral anytime. This is like physical therapy, occupational therapy, and mental health services. Even if you have an HMO, you do not need a referral to see somebody in those specialties. Now that we've gone over some of the lingo, let's look at the plans individually. And I chose to focus on these two. There are a multitude of different types of plans, like your HMO, your PPO, EPO, POS. But these are two of the most popular. And insurance is ever-changing and expanding, and it's kind of hard to find a traditional HMO anymore. There are not that many out there. Like a lot of our HMOs now don't require referrals, even though I still left that as one of the points of the HMO, because that's always something you should look for and be aware of if you are working with that kind of plan. That might be a requirement. Although a lot of the HMO Medicare plans have done away with that need. In the PPOs, there are some that do require referrals. They're sneaky. They're called gatekeepers. which is basically you're paying more for a wider network like a traditional PPO with the limitations of a traditional HMO. But anyway, to go plan by plan, HMO stands for Health Maintenance Organization. These plans were designed to improve care and control costs. HMOs have lower out-of-pocket costs for patients. You'll pay less in premiums, deductibles, and copays. The drawbacks to this type of plan are the restrictions. HMOs typically have a narrow network of doctors and don't often provide coverage for out-of-network services. Another drawback is the need for referrals. Some of the smaller regional Medicare Advantage plans still require referrals, but as I mentioned before, a lot of the larger Medicare Advantage HMOs no longer require referrals, as long as you are in network. HMOs are best for the people that value savings over convenience and are good at keeping track of the administrative requirements of the plan. It's awful to think you're saving money just to be hit with a big bill because you didn't get a referral. Now, PPO stands for Preferred Provider Organization. These plans have higher out-of-pocket costs but offer more freedom. Not all PPOs are the same. Some plans will cost the same per visit, whether you see an in-network or out-of-network provider. Some plans have tiers with an enhanced network, a standard network, and an out-of-network level of providers. Your costs will depend on which level of provider you're seeing. The enhanced network are the providers that have the best deal with the insurance company. So in conclusion, there are many things to consider when choosing an insurance plan. How much you want to pay out of pocket, if all your doctors are included in the network, and if not, are you willing to switch doctors? How good are you at keeping track of things and making sure all your T's are crossed and your I's are dotted? If you're medically needy and require a lot of specialty care, a PPO might be a better option. If most of your time at the doctor's is spent with your PCP, or you're great at staying on top of things and making sure you follow the limitations of your plan, an HMO might be a great way to save on medical expenses. So once again, when comparing the plans, for cost, HMOs typically lower cost, PPO typically a higher out-of-pocket cost. With the networks, HMO typically has a limited network of providers. PPO has fewer network limitations or no network limitations. Some of them have a completely open network. With access to care, referrals may be required with HMOs for specialty care. With PPOs, referrals are typically not required. With flexibility, HMOs rarely offer out-of-network benefits or coverage. PPOs may offer out-of-network benefits. Final thoughts? As I stated before, HMOs are best for those that utilize one network of providers and are good at keeping up with plan requirements. And the PPOs are better for those that value freedom over keeping costs low and utilize providers in more than one network. Thank you.